coming under the program TECLA, which is an acronym for Tele-Education for Clinicians and Leaders in Africa. As we all know, there is always it's always important for us to continue to grow in our capabilities and our capacity to deliver quality service, and that is what TECLA is here to do. It is a multi-country session where you will see that we have participants from Ghana, from Nigeria, from Kenya, but today's session is the primary host is TECLA Ghana. It's a platform for us to also encourage peer-to-peer sharing, knowledge sharing, best practices. We'll be sharing what is happening in Ghana versus what is happening in Nigeria, in Kenya, and other countries in Africa, and of course, the world. We believe this is a good platform for us to learn and continue to improve our capabilities. This session is being recorded, and we're recording because we would want to be able to send you this information so that you have the opportunity to go back, listen, continue to learn. If there's something you forgot, you have the ability to go back and continue to remind yourself of the learnings of today. So please feel free to put on your videos, as we want to see your faces as we go through the session. It will feel like we're all in the same room. Okay, I'm sure as many of you as on this call, you must have registered to get on here. We collect this data just to be able to ensure that we're able to track our program metrics. But more importantly, just to let you know that this data is only handled by people that are authorized to do so. We are certified when it comes to an update and updated when it comes to our data protection. So you have nothing to worry about in terms of who is managing your data and where it is going. Okay, I'm sure some of you are joining from some of our learning sites, both in Ghana, in Nigeria, and Kenya. We have a number of learning sites. These are just facilities, and this is not an exhaustive list. These are just facilities that are part of our program, facilities that have joined to learn and to build a capacity, and facilities that have given us information around areas that they consider areas that we need to focus on to build and close the knowledge gap. We also have our subject matter experts who have been part of our programs at one point or the other, who are bringing their expertise, who are bringing their experience to bear when it comes to teaching and driving this capacity building that we're talking about. You'll be hearing from one of them today, so we're excited about that. We have a couple of partners that we've been working with and will continue to work with, and we're open to having even more partnerships. This is just a slide of all of them. We also have organizations that have capacity building as part of their business model that we work with, but both around the human health side of things, the animal health side of things, and climate. So just in the spirit of focusing on the One Health agenda or concept. We are MDoc. I'm sure some of you are asking, who are we? You're seeing MDoc on my screen. You're seeing it in the slide that is being shared. MDoc is a digital health social enterprise. And what we do is we optimize the end-to-end self-care support for people with regular health needs. So when I say regular health needs, think of pregnancy, for example, and people with chronic health needs. It could be hypertension, cancer, it could be diabetes, obesity, anxiety, depression, just as we'll be able to speak to today. We do this work by leveraging data, technology, behavioral and quality improvement methodologies. We have our various platforms through which we express the work that we do, one of which is our Complete Health app, which is a virtual coach-led app that allows individuals track their health metrics, develop action plans, and continue to ensure that they're taking on healthy lifestyle modifications. We also have our NaviHealth.ai, which we term our Google for Healthcare services, where you can search for the services that you need and you'll be able to find the services around you, use those services or facilities, and come back to give your review on your experience. These will allow the facilities continue to use your feedback to improve their services. We also have our in-person nudge hubs. These are where individuals can actually walk into a nudge hub in their community to learn how to leverage digital tools to drive their health improvements. And then under the MDoc Quality Network, we're able to bring to you this kind of programs where we strive to improve the capability and capacity of healthcare workers and leaders and health administrators, as well as provide strategic guidance to government and healthcare leaders in a way that pushes us towards improving the health outcomes across countries in Africa and beyond. I'll just give you a quick, very quick video on our Complete Health app so that you have an understanding of how to get onto our app or how to also use anavihealth.ai. So please feel free to play the video.
Hello, in this tutorial, I'll walk you through the sign-up process on Navi. Okay. The first step is to enter navihealth.ai into your web browser. Next, click on the sign-up button you can find below. Choose from one of the options to register either as a patient, facility, or healthcare provider. Input your details. You can use a registered phone number or email address of choice. But please note that using a registered phone number is compulsory. Make sure to create a strong password. Once you have done that, click on the Finish button to be directed to input the 6-digit verification code. Get this code sent to your email or your phone number and click to verify the button to complete the sign-up process to get started on NaviHealth. Once the sign-up process is complete, search for a healthcare service close to your location, and once the result pops up, you can search for a facility close to your location. Once you search for a facility, you can click to leave a review on that facility. Make sure your reviews are 100% authentic and original. Input a display name which is not your profile, and thank you for using NaviHealth.
Thank you. Please can we go to the next slide? Thank you. And so as part of our work here, we understand the importance of synchronous learning, such as what we're doing today, but we also understand the importance of asynchronous learning, and that's people being able to go learn at their own pace and at their own time, considering their schedule. And so what we've done at MDoc is to develop what we call a learning management system. I'm sure a lot of you are familiar with that. A learning management system that allows us to be able to provide these resources, these training resources and information on a platform that you can very easily access. And so just as a way to introduce, I think, to the Tekla Ghana team and participants, that this LMS is going to be available to you as well. We did some testing around even the development of the LMS, where we were very intentional about hearing the voices of participants such as yourself, healthcare workers across different facilities, but also health system leaders, to be able to understand where the pain points are, to be able to understand what are the key elements that an LMS such as this should contain. And taking that feedback, we have worked with the engineers to be able to put together this learning management system. And so be on the lookout as we'll be sharing an official announcement I will send to you when we are able to, when you can log in and then start accessing the courses across the different thematic areas in health. So please feel free to ask any questions in the chat. We'll be happy to respond to you. We also want you to follow us on our social media handles. We post snippets and learnings from our sessions on there. We post the adverts for the sessions on there as well, so that it's easy for you to see when a session is coming up, and it's easy for you to also share with your colleagues and people that you know will be interested in these trainings. So please feel free to, whatever platform you are on, please follow us on there. Like I mentioned earlier, we'd love to have your cameras on so that we all feel like we're in the same room, and we can, I believe it helps to enhance our learning. We also, I mentioned earlier, for those who just joined, this session is recorded, and the goal is to be able to share the information with you after the session. We also have the raised hand feature on Zoom. If you have a question or a comment, we encourage you to please be as active as you can and want to be in the chat, putting your questions. We have our team members who are on the chat that are going to be taking these questions to ensure that your questions are answered. If we have enough time, we might give one or two people room to unmute themselves and speak or ask their questions or make their comments. And so just we will be able to do that for you as well. Please keep the introductions coming. We respect everyone's comments and everyone's comments and additions. There's no question that is out of the ordinary. The goal, like my people will say, I don't know how many people know this adage that the person that asks question doesn't get lost. So yes, we want you to ask as many questions as you need to, because the person that asks questions doesn't get lost. So for today's agenda, after this introductory side of things, we will be doing a pre-quiz. And what that is we will put up a few questions for you to answer. Again, nobody's going to judge you. This is just for us to understand where we are at regards the topic. And then we'll go straight into the actual session. We have our subject matter expert on the call already. We will run through a very quick case presentation, and then we'll be able to answer questions. Answers will allow you to ask questions about the different, whether it's the speaker's lecture or just clarity around the case that will be presented. We will do a post quiz. The post quiz is, again, just to be able to see that now that we have learned from our speaker, we have used a case, how best are we positioned to answer the questions that we saw in the pre-quiz. We will do a quick reaction survey because we always want to hear your feedback about the session. We'll do a few announcements and we will wrap up. So I'm asking that you please send this message to your colleagues, because we are about to start the pre-quiz and it would be great for them to be part of that. Okay, so we're launching the pre-quiz now. So feel free to please start answering the questions. They are very straightforward questions. If you are unable to see it, please, excuse me, if you're unable to see the quiz pop up on your screen, if you're using a laptop or a desktop, if you go to the bottom, you will see where it says polls/quizzes. If you click on there, it should pop up on your screen. If you're using a mobile device, where you have more or where you have the three buttons and the three dots, if you click on it, you would see where you have chats, where you have participants, you will see polls/quizzes. Please click on it, and it will pop up on your screen. Please do not share your own personal link with people. We are putting in the chat the link that you should share with individuals, so that we have, because the downside to sharing your link is that you have multiple people joining the session with your name. And so if you have joined with somebody's link and you see that the name on your screen is not the name that your parents gave to you, please feel free to change the name on your screen to your own name. So I think we have multiple Pascals on the call. So if your own name is not Pascal, please feel free to rename yourself. I think I also see Kate Gamfi. I hope I have not murdered your name. I see multiple Kate Gamfis. Please feel free to rename yourself if that is not your government name. Thank you. So please, I'm waiting for answers to the quiz. There are just 8 questions, very straight to the point. Feel free to answer to the best of your knowledge. Again, nobody's going to be penalized for not knowing an answer. The goal is just for us to be able to see where we are in terms of the topic. And then once we go through the lecture and the case presentation, the question and answers and discussions, I believe we'll be better positioned to answer the question. So we will give a couple of minutes for people to take the quiz. Please let us know in the chat if you're having any challenges with seeing, if you have any challenges with seeing the polls, please let us know so that we can support you. Otherwise, I see some answers coming in. I'd like us to please read as quickly as possible so that we can delve into the topic of the day. Thank you so much. Yes, I see more answers coming in. If you're just joining, you haven't missed, we've just done the introductions. Please feel free to start responding to the quiz. This is the pre-quiz, so don't worry about knowing all the answers. Pick whatever you feel is the best suited answer. We will go through the session, we'll go through a case presentation, we'll answer some questions and have a discussion, and we will take the quiz again. And I'm sure by then we're better positioned to be able to answer the question. So don't worry about not knowing everything. We don't even expect you to know everything. Just go ahead and answer the questions to the best of your ability. But you need to attempt, like they say in school, you need to attempt all questions. So all 8 questions you need to attempt. Thank you. We will be closing the polls in about 3 minutes. So please feel free to use the time to answer the questions. Thank you. I see that some people just joined. If you're just joining, we're just taking the quiz, the pre-quiz. So please feel free to join in. If you're unable to see it on your screen, just click on at the bottom of your screen. If you're using a laptop or desktop, click on poll/quiz and it will pop up. And if you're using a mobile device where you have the 3 buttons, just 3 dots, just click on that and you should be able to see polls or quiz. And if you click on that, it will pop up. Again, please remember not to share your own personal link with your colleagues. The link to use is in the chat, so we don't have multiple people with the same name. And if you have used someone's link and you see that the name on your profile here is not yours, kindly rename yourself. And to do that, all you need to do is click on your own, the little box. You would see, right click on there, you'll be able to see where you would see rename, and you can rename yourself on the spot. Thank you so much. Thank you to all who have answered. We will be closing the quiz in about 1.5 minutes. So if you have colleagues who haven't joined, just nudge them very quickly to join. Thank you. Hi, Hannah. We see you in the chat. Great to have you here. Thank you. Okay, we just have 1 more minute before we close the quiz because I'm eager for us to get into the session very quickly. So if you have started, you have 1 minute. Let's wrap this up. It's 8 questions. They're straight to the point. You do not have to know every answer, but just make an attempt. We would like for everyone to attempt all 8 questions. You don't have to know all the answers, so don't be worried about knowing it all. Okay, I'll be starting a countdown shortly. We have 30 seconds, so I will be starting a countdown shortly. Thank you to everyone who has sent a response. Great to see the responses coming in. Well done. Well done. Okay, so we have 20 seconds. I will start a countdown soon. We have 20 seconds, so I want everyone who has started to complete. I don't want to cut anyone off. If you have started and you're still taking it, do you want to?
Okay, we will be closing the poll soon. If you're close to finishing, please let's get on with it quickly so that we can move straight into the didactic lectures for today. So I'll be doing the countdown for us to close the polls. We'll be closing it in 10, 9, 8, 7, 6, 5. I can see some answers still coming in. We'll be closing the poll soon. 5, 4, 3, 2, and 1. I think our facilitator is back.
Yes,
Adwoa,
thank you so much. Thank you so much, Dorothy. So we'll go very quickly into the next thing on the agenda. Thank you to everyone who responded to the quiz. Truly, truly appreciate you. And we will know towards the end of the session how well we did. So we're going to go very quickly into the business of today. We're introducing our subject matter expert. So I have been rehearsing the pronunciation of our subject matter expert's name. So please do not kill me if I murder this beautiful name. I usually play safe. I just say Dr. Adwoa because that's like the easiest one I can see. But then we will try. I'll know if she'll let me know if my rehearsal has been fruitful or if it was a waste of my time. Okay, so we have Dr. Adwoa Kusi-Kyere. She's a psychiatrist and a medical educator with extensive experience in mental health service delivery. She's a member of both the Ghana College of Physicians and Surgeons and the West Africa College of Physicians, and she plays an important role in training and mentoring psychiatry junior residents. She also trains medical and physical and physician assistant students, and she provides guidance and support to primary care professionals and mental health nurses to recognize, evaluate, and manage prevalent mental, neurological, and substance use disorders. These are very key elements of mental health. Dr. Adwoa currently works at the Mental Health Department of the Ghana Health Service Institutional Care Division, and she helps to coordinate, monitor, and develop mental health services in both facility and community-based settings in Ghana. So it's important to note that she has that experience both from a facility-based standpoint, but also from a community-based standpoint. I think it's very important to recognize that blend of these two very critical areas. So without wasting any more of our time, we put our hands together. Please, like I always like to introduce our subject matter experts, we need to applaud them as we give the stage to Dr. Adwoa. I'm sure if you're not clapping, she's not going to be speaking to us. So if you really want to hear from her, I want to be seeing the applause. So put it in the chat, put it on your system, on your profile. Yes, I see a number of people applauding. So we will pass this over to Dr. Adwoa. Hello, ma'am. Can you hear us?
Yes, I can hear you loud and clear. Can you hear me too?
Yes, we can. Perfect. Over to you. So we'll be, please let us know when you want us to move to the next slide. There's a lot of applause in the chat already. So yes, I know that now that you've seen it, you'll very happily take us away. Thank you so much.
All right, thank you so much. If the slides are ready, I think we can move to the first slide. So our discussion today is on the assessment and management of anxiety, trauma, and post-traumatic stress disorder. I must say that this topic is broad. Today's session is going to be an overview, but I hope to answer as many questions that may come as a result of our discussion today. So by way of an introduction, anxiety is a normal part of life. Almost everybody experiences anxiety from time to time. In fact, anxiety can be good for us in that in some situations it allows us to be aware of our problems, to find solutions to our problems. Some anxiety motivates us and prepare us and allow us to improve our performance because the anxiety basically keeps us alert for a task. But typically, we expect that once the trigger event for the anxiety goes away, the anxiety should go away. But this doesn't happen for some people. And this leads me to talk about problem anxiety. So problem anxiety, or what we call an anxiety disorder, typically is excessive, is irrational or unreasonable, tends to affect the daily activities of individuals that it affects. And please, can we move to the next slide? Also, it is very difficult for the individual to control, and even if it is expected, it is usually out of proportion to the situation. So oftentimes these anxiety feelings are more severe and persistent. I must also say that anxiety disorders are very common. In fact, it is the most common mental condition and tends to affect about 1 out of every 7 individuals every year. Next slide, please. We all experience anxiety, and I'm sure that we can relate to some of the symptoms of anxiety. But generally, we like to group anxiety under mental or psychological symptoms of anxiety and physical symptoms of anxiety. For the psychological symptoms of anxiety, an individual may feel nervous, anxious, or on edge. They may find it very difficult to relax. They may have feelings of restlessness and hard to stay still. They may become irritable and agitated and also have feelings of fear. And this fear could be fear of losing control. Sometimes it's the fear of dying, the fear that something bad is going to happen. There is an impending doom. And some individuals who go through anxiety can have a feeling of detachment from themselves or the environment. It is also very common for individuals to experience an inability to pay attention or to concentrate, and then also to have difficulty sleeping, particularly initiating sleep. For the physical symptoms of anxiety, there's often rapid heartbeats, rapid breathing, shortness of breath. Sometimes individuals could feel dizzy, lightheaded or faint. There could be excessive sweating. There could be feelings of choking or difficulty swallowing. There could also be chest pain or discomfort. GI symptoms, which includes nausea, abdominal discomfort. I must say that in Ghana, for Akans, we have a local parlance for anxiety, which literally means abdominal discomfort. So in Akan, if someone is feeling anxious, they say miyem shishimi, which literally means abdominal discomfort. So that is highly recognized. There is also frequent urination. Some people have feelings that look like a fever. You're having chills or hot flashes. Sometimes there is tension in your muscles, which may manifest as pain or trembling in the muscles. And then also individuals could have numbness and tingling in their limbs or their lips. I must say that this list is not exhaustive. Next slide, please. So there are so many types of anxiety disorders, and we also like to group them under those anxiety disorders that occurs constantly and those that occurs in episode. So generalized anxiety disorder is a typical example of the type of anxiety disorder that is constant, and it is characterized by excessive worry over everyday activities. So the person is worried over anything at all. There isn't a specific situation that brings on the anxiety, and the anxiety is constant. So to be able to diagnose a generalized anxiety disorder, you would need 3 or more of the stated symptoms going on for 6 months or more. Next slide, please. We also have the panic disorder, which is an example of an episodic anxiety. This is characterized by recurrent panic attacks. And for each of the panic attacks, it typically starts suddenly. It is often very dramatic, increases from few seconds to minutes, and peaks within about 5 to 10 minutes. Oftentimes, it does not last 20 to 30 minutes. It rarely goes beyond 1 hour. And in a panic attack, there is a predominance of the physical symptoms I talked about, or the autonomic symptoms. So individuals who experience panic attack usually have that fear of having a heart attack. Sometimes they feel they are about to die. And having recurrence of these attacks actually suggests a panic disorder. Next slide, please. Social phobia is also another kind of an episodic anxiety. Individuals basically tend to have
Hello, everyone. Can you hear me?
Yes, Adwoa, I can hear you.
Okay, so I think, like I always say, technology, the blessing and the curse of technology. So I think our speaker just has a slight technical issue. We will be trying to reach her behind the scenes just to make sure that she's able to switch her network. So yes, so just give us a few minutes while we try to reach her to make sure that her network is okay and we can support her as well. But also just thought that it was important to mention that the month of June is a mental health awareness for men. And I think it's important that even as healthcare workers, we are intentional about even spreading this knowledge that we're receiving today from this session with our patients, even as they come along, especially our male patients. I think research is showing that with time, men are getting more comfortable to speak up. And I think it's just, especially within Africa, there's the whole adage of telling men to man up. Men don't cry, you carry the weight of the world, you're just grinding and grinding, trying to make sure that your family is well and everything is going on well. But who then looks after the man? Who can he speak to? How does he recognize the signs of anxiety? Or how does he recognize the signs of any mental health condition? And so as healthcare workers, it is on us to be able to make sure that in our practice, when we see our patients and we see the signs, we are more empathetic, but also we encourage our male patients as much as our female patients, to be honest, to recognize these signs and to seek for help. And of course, work with different coping mechanisms to be able to make that happen. So just give us a second whilst we reach our speaker. Yes, we will share the slides. I see a question in the chat if we will share the slides. Yes, we will. The slides will be shared after the session. We're also recording the session, so we'll try to make the resources available to you. As long as you registered with an email address for this session, you will be able to get it. So at the end of the session, we'll collect the resources and we'll send them as emails to everyone who has joined. So don't worry about it. Don't worry about taking screenshots. You will get the slides from the session. Okay, just give me a minute whilst I try to reach this. Whilst we wait for the speaker, we have an emotional wellness coach here as well, who will be speaking to this. So she's also skilled in this area. She is going to also at some point in the session take us through a case. So she would fill in for now whilst we try to help Dr. Adwoa with her network. Okay, so Success, I think I see you on the call. Can we please enable Success to speak, please? Success, please confirm that you can hear us.
Hi, Adora. Can you hear me?
Yes, we can hear you now.
Okay. Good afternoon, everyone.
Good afternoon. Please go ahead, Success.
Just a second. I'm trying to get this screen on.
It's okay. If your bandwidth won't let you, that's fine. I know that it's been raining in some parts, so it might be one of the issues. Okay. So just 1 second. Success, can you still hear us?
Hi, Adora. Can you hear me now?
Yes, we can hear you now.
Okay, sorry, I was struggling to.
No,
Yes.
hear you now.
Okay, great. Hello, everyone. So I'll just be going over. I'm picking up from where our speaker left off. Okay. So she has given an exhaustive list of symptoms of anxiety. Those are the psychological symptoms. And then looking at the physical symptoms, please, I hope everyone can hear me. I can't really see from here. Yes, okay. So looking at the physical symptoms of anxiety, we'll consider things like racing heartbeats, when someone is exposed to a situation where that triggers intense feelings of fear and anxiety.
Hi, Success. You can go ahead and keep speaking. We can hear you. And Roderick, do you want to support with sharing your screen?
Ayola busy. Yes, I'm still trying to share.
Okay, Dorothy, since you're back on, are you able to support with sharing the screen? And it seems Dr. Adwoa is back in, so we're able to make her the co-host so that she can continue her presentation. Thank you so much, Dorothy. Perfect. Thank you so much.
Hi, Dr. Adwoa. Can you hear us?
Okay. Hi, everyone. I hope you can hear me now.
Yes, Success. But I think Dr. Adwoa is back. So we're trying to see if we can also get her to speak. Dr. Adwoa, can you hear us now? Apologies. This is what network does. Please go ahead, ma'am. Can you hear us?
Yes, I can hear you.
Okay. Please go ahead.
I really want to apologize for the network challenge at my end. Please, can you hear
No
me?
problem. Yes, we can.
Okay. So, continuing with agoraphobia. Agoraphobia is also another kind of an anxiety disorder, which is episodic. And individuals experiencing agoraphobia typically have anxiety and panic symptoms associated with places where an escape is difficult. And so these individuals tend to have a lot of anxiety amongst crowds, public places, and sometimes it becomes difficult for them to travel alone. Some people with severe agoraphobia go on to actually become housebound. Next slide, please. So there's also simple or specific phobia, and this is anxiety to the presence of a specific feared object or situation. Sometimes we all have some fears to certain situations or objects, but these individuals with specific phobia have their anxiety unreasonable or out of proportion to what is expected. And oftentimes, the fear to the object leads to either escaping in the midst of the trigger events or avoidance altogether. So there are several kinds of simple phobias. Some people have the phobia to needles, could be to blood, it could be to spiders, to animals, but I've stated 2 examples here, which is the fear of flying, aerophobia, and the fear of heights, acrophobia. Next slide, please. So let's now turn our attention to trauma. There's a definition for trauma which says that it must be a stressful event or situation of an exceptionally threatening or catastrophic nature, which is likely to cause widespread distress in almost anyone who experiences it. So there are some key words in here. It is an exceptional stressor, number 1, and is often of a life-threatening or catastrophic nature, and tends to cause pervasive distress in almost anyone who experiences it. I have to also say that trauma can be directly experienced or indirectly experienced. So you could have individuals witnessing another person in a traumatic situation and they also get traumatized. Sometimes it is about learning that a loved one has gone through that traumatic situation, or you have been exposed to details of a traumatic event and that traumatizes you as an individual. So this is what we call secondary trauma. Trauma can be a single event or it can be repeated. Repeated trauma, for example, could be in children who suffer repeated physical or sexual abuse. Next slide, please. So these are
I think we are having the same challenge. Bear with us, please. Success, please go ahead. So we will be piggybacking on Success, who is also an expert within this field, so that we can get through the training today. Success, please feel free to go ahead. Thank you.
Thanks, Adora. I hope you can hear me.
Yes, loud and clear.
Okay, perfect. So I'll just be picking up from where our speaker left off. Some of these triggers, as I would like to refer them to, are like rape, very traumatic, usually accompanied by physical and emotional triggers and threats to one's safety and security. Events like rape, events like bombing, and this can be noticed among people who experience, severe insecurity like terrorism, and attacks. I mean, some other examples are criminal assaults, natural catastrophes, like natural disasters, domestic fire, multiple bereavements. Loss has a huge role to play in terms of trauma and even long-term affecting individuals who experience them. There's also robbery, near-death experience. I'm sure for a lot of us personally, we must have experienced, for those of us that have experienced near-death experience, situations or events, we notice that it takes us a while. It could take days, weeks, or even months for us to overcome, some of the effects. That's one of the extremities of trauma. And women as well experience trauma. There's postnatal trauma. The process of pushing out a baby from their body can be very traumatic, especially with the pain and with the blood that is easily observed rather. Okay, other examples are ongoing physical or sexual abuse, combats, especially victims of abuse that is easily triggered by minor things that remind them or give them emotional flashbacks to those abuse that they must have endured for a while, usually years. In terms of combat as well, traumas like PTSD, which is more long-term, is easily observed among war veterans, for instance. And of course, repeated exposure to details of child abuse. Trauma is easily observed among victims of child abuse down to their adulthood. Next slide, please. Hello, can you hear me?
Yes, please. Next slide, please.
I'm not seeing a change from my end.
Yeah, I think there is a slight delay. I think there's a slight delay. Hold on 1 second.
From it.
Sorry, Success, can you see it now?
No, it's still on the
Not yet.
previous page. Yeah.
Okay, so I think our slide DJ, like I say, is probably having slight challenges. But Success, if you check your email, you should be able to see it now. Whilst we try to put it up here.
Okay, no worries, Adora. Just give me a few seconds.
Okay, I think it's up. Can you see it now?
Yes, it's up, but let me see.
Yes, I can.
Perfect.
Yes, can you all hear me, please?
Yes, please.
Okay. So now let's look at the forms of trauma and how they can manifest. So I'd like to consider them as immediate and long-term in terms of acute and post-traumatic stress disorder. So when an individual is exposed to a traumatic event or situation, they tend to respond actually like the speaker said. The anxiety, the fear, and even the physical symptoms are natural. But then there are also certain situations where individuals may begin to feel numb from these situations. I don't know if we've even experienced it on our own when we are exposed to a triggering or threatening situation, and then we become numb, and then over time we realize that we begin to exhibit some of these symptoms that shows us that we have been affected by the situation. Could be physical or the psychological symptoms. But in cases like that, where these symptoms are not as easily observed during the immediate period, I'm talking about during the first day down to 1 month, right? so when they begin to exhibit the symptoms from 1 month and above, from 1 month and 2 days, we tend to refer to that as acute stress or acute traumatic stress, right? When these symptoms are not easily observed immediately within the short period of the event, and then we begin to see the symptoms of trauma or severe anxiety after 1 month and 2 days. And then this categorization is actually standard. That's our DSM-5. When patients come to us,
Hi, Success. You sound your sound is reduced. You sound far.
is this better?
No, it's not. You sound very far. I don't know if you moved your position.
Just give me 2 seconds. Okay, how is this?
This is better. Please go ahead. Thank you.
Okay, thanks everyone. So then, like I said, acute stress disorder is observed within the
Hi, Success. Can you hear us? Okay, I think we might be having a slight network challenge. Please bear with us. We're still trying to reach Dr. Adwoa. But Success, please let me know if you can hear us. Okay, Success is trying to rejoin. Bear with us, please. Sincere apologies for the network. I think the rain is really having an effect on it. So please just give us a few minutes. We would ask our speakers to join without their videos, just in case it helps us. It helps the network or their bandwidth. So please give me 1 minute. I will come back to you.
Success has just rejoined us.
Okay, great.
Hi everyone, can you hear me now?
Yes, we can.
I am so sorry. My network
No, it's
is
okay.
just
It's okay. No problem at all. Please go ahead.
Okay, so let me just go over it. So back to what I was saying. I was saying when we consider acute stress is usually the immediate response between 1 month and 2 days after the traumatic event has occurred. And then in terms of post-traumatic stress disorder, it is more long-term, but we can begin to classify it when we notice the symptoms from 1 month and above. Could be 1 month, could be 2 months, but anything within that threshold can then be classified as post-traumatic stress disorder. So next slide, please. Okay, thank you. So looking at the PTSD presenting symptoms in terms of diagnosis, symptoms that inform us that an individual might be experiencing PTSD and should go for further evaluations. So there are 3 core features that are identified. The first is re-experiencing the traumatic events to come in forms of nightmares, flashbacks. These flashbacks could be very intense and emotional, where we find the person having an episode, in fact. So these are some of the core features. The second one is avoidance of stimuli associated with the trauma. instance, after the period, the person begins to avoid triggers. Could be colors, could be lights, could be similar settings, could even be, we've
I think her network has gone off again, if I'm not mistaken, or is it from my end now? Let me be sure. Can you hear me?
No, I think it's
yeah, we can hear you.
yes.
Okay, it's from her end. Okay. Okay, she just sent me a message. It's from her end. She will be joining back. Apologies. I think today is just a different day, but it's okay. It's okay. And I think I see someone in the chat asking a question about the quiz. Not to worry. And we will.
Just to continue on from where Adora stopped, we would be relaunching the polls after the case presentation. So don't worry if if you didn't get a chance to take it initially, you can always do it after. I believe Success is back with us. I think I just noticed you come in. If you're able to continue. Success? All right.
Hi, can everyone hear me?
Yes, we can hear you. Please go ahead.
Okay. So let me just quickly rush over because of the time. So like I was saying, we've seen cases where people are easily triggered by, as little stimuli. It could be vibrating of a phone or someone's loud voice or even colors that, are related to the traumatic event. So when you find individuals deliberately avoiding this, stimuli that could trigger flashbacks, it's one of the core features. Another thing is increased arousal. That's when exposed to things that can trigger them. You find them feeling, easily anxious, throwing tantrums, could also come in form of sleep disturbances. A lot of people have these recurring nightmares and then hypervigilance. Next slide, please. So, so anxiety can occur in most psychiatric disorders. Anxiety has been observed to co-occur with many disorders. So you can see someone experiencing major depression accompanied by anxiety, same as schizophrenia, dementia, bipolar disorder, OCD, and a variety of other conditions that are co-occurring with anxiety in different severities. Next is many patients have more than one anxiety disorders. They can have more than one anxiety disorders occurring at the same time, right? And usually in the first episode of acute anxiety, we can also consider factors like potential abuse of substances, use of alcohol, cannabis, abuse of prescription drugs, use of under-the-counter drugs, and other substances like caffeine, cocaine, using drugs, basically, amphetamines, and the rest. So some medical causes of anxiety could be an atypical presentation of MI, which especially accompanied by severe nausea, vomiting, hyperthyroidism, hypoglycemia, and the rest. So when, as professionals, when we come in contact with people who are exhibiting symptoms of anxiety, any of the different types, it's important for us to take, some of their metrics, like their blood pressure level, their FBC, glucose level, and the rest, before we do, baseline psychometric assessments using tools like the GAD, which is generalized anxiety disorder. There's also the PCL5, which is used for PTSD, and we can now refer for further evaluation. So some common screening tools, like I mentioned before, for anxiety, we have the GAD, which is generalized anxiety disorder scale. There's GAD-7, and there are other scales with many other questions, right? So there's also the Beck anxiety inventory. There's the Hamilton anxiety rating scales. These can be used by clinicians and non-clinicians. So people that even have basic mental health experiences can administer some of these tools, like the GAD. Next slide, please. Next slide, please. Okay, so let's just have a summary of everything that we have learned so far. So we'll be looking at the disorders, the groups that are at risk of these disorders, the description, and then the duration for diagnosis. So in terms of GAD, which is generalized anxiety disorder, it's usually can affect everyone, but then the specific groups at risk are women aged 30 to 50 years, usually women in a lot of the cases, people with a family history of anxiety or mental illness, people who are experiencing chronic medical conditions or a significant stressful situation. And then, like we have learned earlier, the descriptions are constant worry, feelings of anxiety, distress, and we can begin to diagnose it from as little as 1 week to 6 months and above. In terms of panic disorder, like we learned, is the intense and anticipation of a triggering event, right? And so it occurs usually in late adolescence or in early childhood. And then the peak onset is mid-20s, usually affects women and women with a history of mental illness or anxiety, as well as people who are exposed to major life stress or trauma. It occurs in short episodes with prominent autonomic symptoms, like the speaker mentioned. And then people usually experience at least 4 attacks within a 4-week period. In terms of phobias, it usually starts in childhood down to adolescence and even up to early adulthood. Affects women and people with history of mental illness, people who have experienced traumatic events, usually closely associated to the phobia that they have. So it could be someone who has had a road accident and then they develop a phobia for that, or even flying and then they develop aerophobia. Individuals with inhibited or anxious temperaments, right? So those are people who are, in the risk factor group. And then the episodes are usually precipitant and occur at least within 6 months. So in terms of PTSD, which is the long-term post-traumatic stress disorder, it can occur, it can occur in any age group, can affect women, men. Usually we can easily observe this, in veterans, people who have been exposed to, threats to security, terrorism and wars, right? We can also observe this among people who are survivors of physical or sexual assault, people who have gone through abuse, people who have been exposed to near-death experiences like serious accidents, natural disasters, like we mentioned before. And then the symptom of anxiety in these cases is usually the exceptional stressor that can be easily observed. And like we mentioned before, it can be observed starting from 1 month up to 6 months and 2 years after the traumatic events. So just to note, these symptoms must be primary. Please, can you go back just a bit? I wanted to note this. Sorry. Okay, so the symptoms must be primary rather, not secondary. That is, the presenting symptoms must be directly linked to the condition that we'll be addressing, and not secondary. And it could be due to delusion, psychosis, a medical condition, or substance use, like we have outlined. Okay, so next slide. So in terms of managing these anxiety disorders, so there are two main modalities for treating anxiety disorders. The first is psychotherapy. This is undertaken by a trained clinical psychologist, usually in a clinic or in a facility. And one of the most prominent treatment methods that is used is CBT, which is cognitive behavioral therapy, where we are able to target the cognition and then the behavioral manifestations of these anxiety disorders. Next is, use of SSRI, serotonin reuptake inhibitors, and it is used long-term or used as a maintenance for the treatment. So we have beta blockers, we have BDS, and those ones are used short-term to treat the symptoms. And so these treatments can be used on their own or in combination, especially in cases that are mild to moderately severe. The first treatment is, psychotherapy, where the individual undergoes, consistent reassessments with these tools. We're introducing the intervention. And then when the cases are severe, in many cases, they are now prescribed medications. So some mild cases of anxiety typically don't require, any specific treatment. They are just approached with general treatment like psychoeducation, which is teaching the person, educating the person about the conditions, why they are experiencing these things that might be triggering them. Exercise is also a very good approach to treating anxiety, because it helps produce, relaxing hormones like endorphins, right? There's also the place of eating a healthy, nutrient-dense diet and sleep. As we've learned before, when it comes to anxiety and its different forms, sleep is usually one of the issues. Individuals experience sleep disturbances, difficulty sleeping. So, treating that, indulging in sleep hygiene could be one of the approaches that would help, as well as, relaxation, deep breathing exercises, yoga, meditation, Tai Chi, and, support groups. Speaking, talking alone is a very good approach to helping people, number one, feel like they are actually normal. What is happening to them is not bizarre, they are not weird, and then they are able to share their experiences with other people who are also experiencing these things and get support. Those are cases of, mild anxiety. So I hope we've been able to learn from everything that has been said so far. This is a very interesting topic, and I would encourage us to look through the materials that will be shared after this training to just familiarize ourselves with what we have discussed today. Thank you so much, everyone.
Success for moving case, please to the case chat. You can use it to drive. Thank you.
Okay. So I'll be taking the case presentation for this training. My name is Success Smith, and I am an emotional wellness coach working in MDoc Healthcare. So just an overview about what we do. MDoc's emotional wellness coaches, we are psychologists, mental health professionals who support people living with depression and anxiety virtually. We provide CBT, supportive therapies, mindfulness-based therapies, behavioral modification to our members. And then in cases of severe mental illnesses where people are experiencing severe symptoms, we make external referrals to clinics, to facilities for further evaluation and treatment. Next slide, please. Next slide, please. Okay, so while we're changing the slides, let me just go over the case we'll be presenting today. So the name of this member is member 80. So we're not referring to our members as patients or clients, just to make them feel more comfortable and make them feel like they are part of a family who's here to support them. So the member's name is 80. That's the initial we'll be using for her today. She's 34 years old, married, of Igbo ethnicity. She's a Christian. She works as a customer success specialist and has a bachelor's degree certificate. In terms of her past medical history, her blood group is B+, genotype AA, and then she reported to have used substances for 3 years during her university days. She has no previous surgeries. She has no previous psychiatric diagnosis, although she reported feeling depressed since childhood. She has always had this feeling of, depression since childhood, although she has not gotten a proper diagnosis for that. She reported to have self-harmed during her teenage years from 14 to 17 years by cutting her wrists. And then she reported that her father has a history of alcohol abuse, but she doesn't have any history of using alcohol or drugs. And there is no known family history of suicide or any psychiatric disorders. So down to the traumatic events. So 2 months before seeking help, A.T. was kidnapped during a work trip in northern Nigeria. She endured captivity for 8 days under distressing conditions, where she was made to drink dirty water. She fed on leaves and moldy bread for sustenance. She was beaten severally, which resulted in a broken leg. She witnessed her colleagues being severely beaten, and then a female colleague was sexually assaulted. Her menstrual period came 6 days early, which she endured without proper hygiene products, and was forced to participate in grueling morning parades, which involved standing under the hot sun for hours. Fortunately, her husband was able to come for her release after taking a loan of 6 million naira. So as at the time she reported to us for support, she reported symptoms like difficulty sleeping, nightmares. She was getting poor sleep, just 3 to 4 hours on most nights. She had intrusive memories and emotional flashbacks of the events. She had a burning sensation in the chest, persistent sadness and hopelessness, complaints of loss of interest or pleasure in activities she used to enjoy. She complained of low mood. She says she gets startled easily. There was the case of hypervigilance, avoiding reminders of traumatic events, persistent sadness and hopelessness, and social withdrawal and isolation. So the onset of these presenting complaints was 1 week after discharge from the hospital. Okay, so in terms of the diagnosis assessments that was used, so member 80's emotional wellness coach administered the following baseline assessments. The coach used the patient's health questionnaire 9-2, where the member scored 23/27, indicating severe depression, with positive scores of 2 on thoughts of self-harm for more than half the days. She was also assessed using the GAD, Generalized Anxiety Disorder Assessment tool, where she had scores indicating severe anxiety. She was immediately referred to a psychiatrist and was diagnosed 2 weeks later. She reported the following assessments from the clinic. She was assessed using the post-traumatic stress disorder checklists for DSM-5, PCL-5, where she had scores indicating PTSD. She had a traumatic brain injury assessment, which came out negative for possible head injury. And then she was assessed with the Insomnia Severity Index, which indicated severe insomnia. So getting this diagnosis was a huge relief for this member who previously feared that she was losing her mind. So the treatment progress in the clinic was that she completed 7 sessions of psychotherapy within 5 months. She was prescribed sertraline, 100 milligrams daily, and clonazepam, 0.5 milligrams twice daily. During that period, she gained 11 kg of weight from 78 kg, which she previously was, to 84 kg. Sorry, 74 to 84. And then the clinical psychologist at the clinic started her on cognitive therapy sessions. So based on her interactions with her emotional wellness coach, she had 4 sessions with her coach over the span of 5 months. So she was active for 5 months after the traumatic events. So in line with PHQ and GAD guidelines, she was ideally reassessed bi-weekly during the first month. But then the frequency of these assessments dwindled over time because of her unavailability. And so the session she had with her emotional wellness coach focused on, complementing the support she was receiving from the clinic. She was supported to complete her cognitive therapy assignments, engage in self-monitoring, mindfulness-based stress reduction therapies, and she received emotional support. So the emotional wellness coach made sure to involve a support system, which is her husband, during 2 out of these 4 sessions, just for the extra support. She was also advised to engage in some lifestyle modification, like exercising frequently, indulge in self-care, and she was referred to a nutritionist to improve on her diet. So after 5 months, she experienced the following progress. She reported an increase in sleep time. Remember, it was 3 to 4 hours at the start of the support, but then it had increased to 4 to 5 hours per night. And then she had begun to take 45 minutes nap once in a week. So her symptoms improved from severe to moderately severe depression. And then for anxiety, it reduced from severe anxiety to moderately severe anxiety. And then she reported no thoughts of self-harm. So in terms of exercise, she had already started attending the local gym with her husband twice a month. And at the end of 5 months, she reported a 2 kg loss in her weight. So member 80 reported taking up gardening as a hobby, as she had started working remotely and she was working for lesser hours, so she had more time. She also began on a nutrient-dense diet where she started eating more fruits and vegetables. So in terms of the status of these patients as are now, so following the 5 months progress period she had, this member unfortunately faced severe financial challenges in a bid to pay back her debt. So remember in the beginning, her husband took a loan to secure her release, and this caused the problem later on. So she suffered threats from the creditors, where they even invaded her home to possess her furniture. Her husband was also arrested. So when she had a session with her coach, she reported severe emotional distress, insomnia, hypervigilance, and triggered emotional flashbacks. Her assessment scores revealed that she had severe depression and severe anxiety, as well as severe PTSD. So she was referred back to the clinic, and the emotional wellness coach contacted her or tried to contact her severally for follow-up to know if she had gone to the clinic and how she was doing, but she was unresponsive. So her husband eventually informed the coach that she had discontinued her treatment at the clinic as they were relocating to her hometown due to their deaths. And since then, no contact has been made. So some questions for discussions are, was the support from the emotional wellness coach sufficient? Was the clinical treatment substandard? And for our speaker, how would you advise this case to have been handled? Thank you.
Thank you so much for some of the questions we have. Before we go to the post because I want to move our time. So there's one around the ability to individual probably stop medicine and a side effect. Please can move this question screen, please. We are ready to other questions received. Success.
Sorry, Adora, you're breaking up. I don't know if it's from my end.
Hear me now?
Yes.
I was saying there was to how do you pay abruptly their medicine due to effects?
Sorry, I can't hear you, Adora. Your internet is breaking up.
Can anyone meet, please?
Adora, yes. So we can hear you, but you're breaking up, so it's not really clear. We can't make out what exactly you're saying. Okay. So I think Dr. Adwoa just joined us. But I think I'll just go ahead and continue what Adora was saying earlier. So, Success, the question here is, how do you manage a patient that abruptly stopped their medication due to side effects? Can you hear me, Success?
Yes, I can hear you.
Okay.
So
Would
how
you
do you...
repeat the question?
Yeah, can you repeat the question?
Sure. So how do you manage a patient? How do you manage a patient that abruptly stopped their medication or their medicine due to side effects? So for instance, they were having side effects and then they abruptly stopped the medication. How do you manage such a patient?
Okay, thanks, Dorothy. So I think the first step as a coach would be to have a psychoeducation and counseling, session with the member where I'm fully able to understand these side effects and how they are manifesting, and then make a referral to the psychiatrist who prescribed the medication to see if there are alternatives that, this member can go or this patient can go on that would have, similar effects on the symptoms that they are experiencing. So in this case, provide psychoeducation, counseling, and then refer back to the prescribing psychiatrist for a possible change to the medication.
Okay. Thank you so much, Success, for that clear response. I think our speaker is back. Dr. Adwoa, can you hear us? Hello, Dr. Adwoa, can you hear us?
Please,
Yes, I can hear you now.
Okay.
Hello.
Hello, please, can you hear me?
Yes, Dr. Adwoa, we can hear you. Thank you so much for joining back. We recognize that you were having some internet challenges, and we just ran through the case presentation. There was a question around how to manage a patient that abruptly stopped their medication due to side effects, and then we had Success, share her thoughts on that one. But then we just wanted to find out from you also. There's another question. What are the best practices for communicating with patients who have experienced trauma? I think it's one question that has come up, and we'd like you to share your thoughts on that as well. What are the best practices for communicating with patients who have experienced trauma? So over to you, Dr. Adwoa.
Okay, thank you very much. What I would add to the patient that stops medication abruptly, you have the risk of having withdrawal symptoms. For some people, that might be minimal. But if you were having side effects to medication, what we advise is for you to report that to your healthcare provider, who would know how to optimize you on the treatment. For some medications, just reducing the dose can actually reduce the side effects, and then you can continue. But in some cases, we may have to switch you onto another medication altogether. So that's the comments I want to make with regards to stopping medication abruptly. And then best practices when it comes to communicating with someone who has suffered a trauma. I have to say that usually we ensure that we are not judgmental when communicating with these individuals.
Mhm.
Going through a traumatic experience is not easy. And so it may take time for the person to open up and even talk about the issue to the therapist or whoever is the healthcare provider. And so we would not usually, during the first encounter, force the person or pressurize the person to talk about the traumatizing situation. And
Right.
oftentimes for primary care providers, we would actually advise that, especially if you are not well skilled, to be able to intervene and support this people, because these people are likely to break down while trying to open up to the healthcare provider. So if you are non-specialized and you do not have the skill to actually address and support the individual while they speak about the traumatizing situation, we usually would not ask you to get the patients to debrief you about whatever they have gone through. But for the therapist, they know what to take the patients through. But usually we would not pressurize the patients to speak when they are not ready to. And we are always welcoming for them to open up whenever they are fine with doing that. Thank you.
Thank you so much, Dr. Adwoa, for that clear response. I think without taking much time, would like to go straight into the post quiz. So we are going to launch the same set of questions that we launched when we started this session. Please feel free to send in your responses. The questions are mostly connected to the lectures that we've had today. So we are hoping that the answers that will be coming in will have more people answer based on what they've learned today. So we are launching the post right now. Please feel free to take the quiz. It's up on the screen. Please go ahead and then answer these sets of questions, just 8 questions, so we can move through it quickly. Just to mention again that you're not being graded for this quiz. We are only doing this to be able to measure the knowledge that we've gained for this session. So please go ahead. I want to see some more answers coming in. These are the same sets of questions that were launched. Don't worry if you didn't take it at the beginning of the session. Please go ahead and then answer these ones as well. If you cannot see it on your screen, if you are using a mobile device, please go to the bottom of your screen. You would see some 3 dots. Just click on the 3 dots, look through the list, you will see polls. Just click on polls, and then you can go ahead and then answer the questions. Still waiting for some answers to come in. Please feel free to share your thoughts on this. You are not being graded. Just to remind you again, I want to see some more answers coming in. Thank you so much. Thank you so much for staying on with us through all the internet challenges that we're having. Yes, I see some answers coming in. Please keep them coming so that we can wrap this up as soon as possible. Yes, I see some answers still coming in. Please go ahead and then answer the questions based on everything that we've learned today on trauma, anxiety, PTSD, how to manage it, how to deal with your patients when they come to the facilities and you notice these signs. You've gone through some of the signs that you can use to identify when someone is having anxiety. You need to identify what someone is having trauma and when it's upgrades to PTSD. So please feel free to take this quiz just to measure your knowledge on what you've learned today. I see some comments in there. Thank you so much, Hannah. Thank you too for joining. Yes, well done to the speakers. Well done to everybody despite the tech challenges. Just as our facilitator said, internet can be a blessing and it can be a curse as well. Thank you so much for those who have responded so far. I want to see more responses coming in. We'll be closing out soon, right after the polls. So please feel free, keep your answers coming in. After this, we will just we'll just run through the questions quickly and then we can close out. So please, yes, I see some more answers coming in. Please keep them coming. Just a gentle reminder again, you are not being graded for this. We are not collecting your names or anything to grade you against, to grade it against your names. It's just purely anonymous. Please go ahead and share your responses, share your thoughts based on everything that we've learned today from our subject matter experts. Thank you so much, Dr. Adwoa. Thank you so much, Success, for this. Yes, I see some comments in the chat as well. Thank you so much, Enoch, as well. We hope to see you in our next session. Thank you, Matthias, for your responses. Yes, we'll be closing the poll soon. In less than 5 minutes, we should wrap up with the poll. So please, if you are here to submit your responses, please do that immediately so that we can proceed with the session. Thank you all so much for all those who have input their answers so far. Let's keep them coming. We'll be closing the polls out soon. We'll be having a countdown and then we will end the polls. Yes, thank you so much for your responses. We'll be closing the polls in 10, 9, 8, 7, 6, 5. Okay, I see some responses coming in. Let's just give just a minute to allow more people to just send in their responses so that we can close out on the polls. Yes, I see the responses coming in. You're doing well. Thank you so much for participating in this session. Just as I mentioned earlier, please be on the lookout for our upcoming sessions as well. Yes, I see the comments. Thank you, Oladayo. Yes, well done to the speaker. We are so grateful. Yes, Miss Emma Morrison, we will definitely share the slides as the facilitator said at the start of the meeting. Okay, so I think we should be closing the poll soon. I'm going to start the countdown again so that we can wrap up on that. So we are closing the polls in 10, 9, 8, 7, 6, 5, 4, If you have to put in one last answer, please put that in so we move. 3, 2, and 1. So we are closing the polls now. Oh, interesting. I see more responses coming in.
Actually, can you?
Yes, Adora, we can hear you, but you're breaking a bit.
I still have so many to if you're feeling you I raise a phone call to need post.
Okay, so we are closing the polls in 3, 2, and 1. I think that was enough time to wrap up the polls. Thank you all so much for taking. So we are ending the polls now, and we're moving. Dr. Adwoa, are you still with us? We just want to run through the questions quickly. Dr. Adwoa, please let us know. Okay, Dr. Adwoa is still here with us. So we are going to run through the questions quickly so that you can give us answers to them. Dr. Adwoa, can you hear me?
Yes, I can hear you.
Okay, great. So we are just going to quickly run through the questions so that participants can know whether they got it correct or not. So I'm going to read the first question. The following disorders occur in episodes except A, generalized anxiety disorder, B, panic disorder, C, social phobia, and then D, specific phobia. Dr. Adwoa, can you give us the answer?
It's generalized anxiety disorder.
Okay, great. Generalized anxiety disorder. Second question, the fear of dying due to heart attack is commonly seen in A, generalized. Great. Dr. Adwoa has already given us the answer. Panic disorder. We're moving through quickly. Question 3. The question is, Mr. Mensah avoids driving a car, leaving the comfort home, shopping in a mall, traveling by airplane, and simply being in a crowded area. He most likely has, Dr. Adwoa,
Agoraphobia.
agoraphobia. So kudos to all those who chose agoraphobia. Question 4, we have the following are examples of anxiety disorders, except we have a number of options. We have generalized anxiety disorder, illness anxiety disorder, social anxiety disorder, and then acute stress disorder. Dr. Adwoa, can we have the answer?
The answer is illness anxiety disorder.
Illness anxiety disorder. Kudos to everyone that chose that answer. Question 5, we have the fear of flying is, Dr. Adwoa, can we have the answer?
It's aerophobia.
Aerophobia. Thank you so much. Question 6, which of the following is not a symptom of post-traumatic stress disorder? We have multiple personality, B, avoidance, C, traumatic experience, and then D, flashbacks. Can we get the answer to that?
Yes, it's multiple personality.
Multiple personality. Thank you so much. Question 7, all the following as physical symptoms of anxiety, except we have nausea, chills, difficulty swallowing, and then fear.
Fear.
The answer is fear. Thank you so much. So we are going to the last question. Which of the following statements is true? The first one is generalized anxiety disorder typically lasts for less than 6 months. Second option, panic attacks usually last for an extended period, often more than an hour. The third option, generalized anxiety disorder involves anxiety about specific situations or events. And then D, acute stress disorder is characterized by anxiety with onset within 4 weeks. So which of the following statements is true?
So acute stress disorder is characterized with anxiety with onset within 4 weeks. The last answer, please.
Right. So thank you all so much for engaging in the polls. Thank you so much, Dr. Adwoa, for your time taking us through this. And thanks to everybody that took the polls. We will go ahead and then share the slides as we have promised. So we want to launch a reaction survey. We just want to know how this session was like for you. So we are going to put that up as well. Please let us know so that we can curate the next session to suit you better. So I am launching, this is just a 5-question survey. Let us know if the training met your expectations. Let us know how helpful it was to you. Let us know if the length was okay. Let us know how helpful the case presentation was. So please go ahead and share your feedback. Your feedback is very critical and it's very important to us so that we'll be able to improve and continue to improve on our sessions with you. So thank you. I see some responses coming in so far. Thank you so much. Please try and fill out this survey before you drop off the call so that we can make use of your feedback to improve these sessions for you. Thank you so much for those who have participated so far. We'll be closing out soon. Thank you all so much. Yes, I see the responses coming in very quickly, very fast. Thank you so much. We should be closing out soon. I see all the comments in the chat section. Yes, thank you all so much. Thank you so much. So I see our emotional wellness coach Success is responding to some of the questions you had in the chat. Thank you, Success, for that. Yes, we should be closing out on the reaction survey soon. So if you've not sent in your feedback, your responses to us, please do so right now so that we can close out in a bit. All right. We'll be closing out on this soon. If you are yet to finish your responses, please do that quickly so we can close out. Okay. So we're closing this out in 5, 4. Okay, I see some responses coming in. Let me just give us a minute to close out on the reaction survey. Just as I mentioned, your feedback is very important to us. It is by that way that we can know how to serve you better during these sessions that we hold. All right. Thank you all so much for your feedback so far. And thank you so much for holding on when we're having the technical challenges. We really appreciate your patience on this. So we're closing out these polls in 5, 4, 3, 2, and 1. Really appreciate your support on this. So we're ending the post now. Great. So we're just running through this quickly. Just as we mentioned at the beginning of the session, we have a learning management system that will be housing most of these our learnings on. So once this is ready, we're going to announce and we're going to share with everybody. We'll have free courses, we'll have paid courses, we'll have a wide range of courses that are tailored to all health caterers, so doctors, nurses, nutritionists. Think of all the health caterers that we have. We're going to have all these learnings on it. It should be out soon for everybody to be able to have access to that as well. Great. So please be on the lookout for our next sessions. We'll be holding some sessions in July and August, as well as September. And we'll be hoping that we'll see you in your numbers. Thank you all for those who shared the flyers and then shared the information with their colleagues, their friends to be able to join. We really appreciate the support. And we'll be expecting that the same thing happens when we are holding our next sessions as well. We are looking to have some sessions on cardiology, on maternal health. So please be on the lookout, and we will put the information out there as well. So please follow us on our social media platforms, on Facebook, on Instagram, on Twitter, on YouTube, and on LinkedIn at MyMDoc For the website, you can visit our website as well, see what we do. Just as we mentioned before, we are a digital health social enterprise that optimizes end-to-end self-care support for people living with regular and chronic health needs. Okay, so we want to thank you all so much for coming. We really appreciate your time. Please feel free to drop in the chat your thanks, your appreciation to the speakers today. They really, really did a great job in sharing with us from their wealth of experience and knowledge on how to access and manage trauma, anxiety, and PTSD. And as you all already know, last month and this month are mental health months as well. So this is a good time to hold a session so that we are all on the lookout and aware of the patients that we receive in our facilities. We've learned how to look out for the signs, how to manage, how to share the case. And I think this was a very insightful session. So thank you so much, Dr. Adwoa. Thank you so much, Success. And thank you all for joining. We really appreciate it. Bye, everyone.